And welcome back to Black Renaissance. Please welcome from the AIDS Project of the East Bay, Executive Director, Minister Rob Newells, and Angela L. Green, Director of Health Promotions. Welcome, both of you. I was so glad to talk to you just a little bit about this program. And I kind of want to get, when we're talking about HIV and AIDS right now, currently in the Bay Area, I think a lot of people sort of, in some way, you kind of back burner it. It's not the crisis that it once was. So give us sort of an idea of where we are. What are some of the statistics as far as in our area?
You know, when APEB was started about 30 years ago, it was started because there was a disparity between the way that the people in San Francisco were getting HIV prevention and education and the way that people in Oakland, particularly black men in the East Bay, were getting that information. And those disparities exist today. The CDC just released in February some statistics that said 1 in 2 black men will test positive for HIV in their lifetime if we don't do something about it now.
1 in 2?
1 in 2 black men who have sex with men will test positive in their lifetime if we don't change something right now. So the disparities are real. Places like Boston, Chicago, San Francisco, New York have plans to get to 0 new HIV infections, but that's not the same for cities in the shadows of those larger cities like Oakland.
Is that an access issue?
Some of it is access, a lot of it is education. People will tell you we have the tools to stop the epidemic now with treatment as prevention, with things like pre-exposure prophylaxis and post-exposure prophylaxis, which is like birth control for HIV or the morning after pill for HIV. But our communities don't get that information necessarily, so we don't know about it to be able to access it.
So in many ways, it really still is a crisis for some communities at crisis levels. Angela, talk to me about really the mission of the AIDS Project of the East Bay and what kinds of campaigns you guys are working on now.
Our mission is to serve underserved communities who are affected by this pandemic, and we are unapologetically black, and the black community is our main focus. We have services that take us out into the communities. We have HIV testing. Our mobile unit goes out into all areas of Alameda County to test. We offer primary health care at our agency. We not only serve HIV and AIDS, but the whole entire community. In fact, we have a new logo, APEB, and we're trying to get away from the AIDS Project of the East Bay and becoming more inclusive of everyone in the community to draw them in. We have housing programs, substance abuse programs, we have youth programs. And so we are really a one-stop shop to provide services in the community. Some of the campaigns we're working on is our Unapologetic campaign.
Tell me about that a little.
Unapologetic is about trans men and women who are African American and how we kind of get lost in services when it comes to our white counterparts, and how we have to deal with stigma and different situations and health disparities in our community.
We've certainly had a lot of conversations and a lot of about trans people recently. A lot of times trans people of color get left out of those conversations.
Exactly.
And so this campaign is meant to address that?
Exactly. So we're posting every week on our, I think it's every week?
Every week.
On our website. We have photographs of different trans individuals and their bios and what some of the things that we're doing and we're working on, myself included. And we're all on June 24th, we're having a showing at the
Joyce Gordon Gallery in downtown Oakland.
And that will be at 6 p.m. on June the 24th.
That's fantastic.
And so people will be able to come by and see the photographs, and I'll be there, and one of the other participants will be there to share our stories.
That's great. Can you talk about what sort of makes, when we talk about some of these really disturbing statistics, some of the issues with access and some of the issues with invisibility in this community, what sort of is the difference that you are looking to make? What says we're making a difference and we're making progress in these areas?
You know, there's been a state of emergency around African Americans in HIV in Alameda County since 1998. And when I asked the health department director, what do we need to do to get out of the state of emergency? He showed me a graph that showed where African American HIV infections were up here, and then everybody else was kind of grouped together down here. He said, once we can get African American infections down with everybody else, then we'll be out of a state of emergency. And so our goal at APEB is to make sure that everybody has access to the right information, rather than having to go to San Francisco to get information, to get treatment, to get testing. We want to make sure that it's in the community, not just in our downtown Oakland location, but we have a drop-in center for youth in East Oakland. We're working on a program with City of Refuge United Church of Christ in East Oakland also to open up a new clinic over there. We've started working with Missy with sexually exploited youth to provide services for them. We have a mobile testing unit that goes out to all kinds of places in the community so that we're meeting people where they are as opposed to having them come to a big city someplace to get their stuff.
Absolutely. The help needs to be in the community.
Absolutely.
And the numbers need to reflect that help. And it sounds like that's exactly what you're focusing on.
Exactly.
It's such a pleasure to have both of you on the program today. Thank you for the good work that you're doing. And if you're looking for more information about the AIDS Project of the East Bay, you can log on to their website, apeb.org. That's apeb.org. We'll be right back with more Black Renaissance right after the break.